Community water fluoridation is a public health measure that has benefited millions of people over the past 60 years. For its low cost, it has improved the quality of life through reduced pain and suffering related to tooth decay, reduced tooth loss, reduced time lost from school and work, and less money spent on dental care. Furthermore, anyone, regardless of the social economic level, can enjoy its benefits. It is the most cost-effective method of prevention of tooth decay. Areas which have added fluoride to the municipal drinking water have seen a 20 to 50% drop in the incidence of tooth decay. Not to mention the severity. Logically, those communities that have removed fluoride from their water can expect a doubling of their decay rates. On an annual basis, it costs less than $1 per person per year to fluoridate our water. With the average cost of $100 to $300 per dental restoration, it doesn't take a mathematician to calculate the cost of removing fluoride to the residents of Tecumseh over time. And I'd like to mention that there was a study in Dorval, Quebec, was one where they, after 2 years of non-fluoridation, they decided to put it back in because they noticed that in the kindergarten-age children, the study here, the 2007 report on water fluoridation by the public health group there in Quebec, reveals that the percentage of kindergarten children at higher risk of developing tooth decay in Dorval doubled in the 2-year period after water fluoridation was halted in 2003. These are facts. As with other substances added to our materials we consume, like vitamin D in milk and iodine in table salt, fluoride is safe to consume in the recommended levels. Indeed, if there are any negative effects from consuming the fluoride added to our water for over 60 years, it would become plainly evident in higher rates of disease and ill health in our community, which would be directly linked to the intake of fluoride. This has not happened. A couple weeks back, I was speaking with a colleague of mine, and I believe I provided a letter to you. Do they have copies, or was I going to distribute them?
Are you referring to the letter of Dr. Nagayan?
Yes.
Yes.
They have copies already? Would you like me to read the letter?
Yeah.
Okay. Dear Council, I am writing this letter to express my personal opinion and experience on fluoridation in the city drinking water. I am a dentist in the township of Leamington, which is not a fluoridated community. I have moved to Leamington to practice for 3 years now, and I have seen more than enough cases of rampant decay in children and heavy recurrent decay in adults and root decays in seniors that make me wish that fluoridation was a part of every city's tap water. There are enough studies to support the addition of fluoride to the city's tap water. The potential savings to the government, patients, and insurance companies would be enormous. It is our job every day to see that our patients get the best of care, but the time in between that ultimately determines the status of our patients' oral hygiene. We can give them the best information and education on how to take care of their teeth, but as we all know, everyone is busy, and sometimes affording proper dental products and seeing dentists regularly can be a challenge. However, if fluoride was available in tap water, it would always be available to help the patient and the dentist combat the demineralization of teeth from the oral bacteria. I do not need to list all the studies that have been done over the years to provide that fluoride, or to prove that fluoride in drinking water is the most effective and efficient way to reduce dental decay for patients of all ages. But if such studies were needed to help keep the fluoride in the Tecumseh area, then I will be happy to provide the Council with numerous studies that support fluoridation. I urge the Council to give it serious consideration to continue to fluoridate the city of Tecumseh water source. The benefits have been proven over and over in many communities all over the world. The result of not having fluoridation will take many years to surface, but as the Township of Leamington has seen, it is not a bright future without fluoridation. I realize that poor oral hygiene is a multifaceted problem, but when those families without access to good dental care, proper dental education, and proper dental products to help them combat decay, then they will need all the help they can get. Reaching out to these types of families is a very difficult task. but fluoridation of the drinking water is a very cheap and efficient way to get to all families of all different walks of life. Thank you for allowing me this opportunity to express my opinion on water fluoridation, and I hope that Council will vote to keep water fluoridated for the Township of Tecumseh and help other non-fluoridated communities see the importance in this matter. Sincerely, Dr. Hui Wen. When I did the interview this morning, I was somewhat short on time because I was at the hospital about to start in the OR. And my first two patients were children with teeth similar to what you saw on Dr. Hyman's slide from Leamington. If these children had fluoride, they wouldn't have had to see me in the hospital to be put to sleep for the work. I've lived in Tecumseh for 25 years. My family's grown up here. You know, my children, they need the fluoride in the water. Thank you.
Thank you, Dr. Hyman and Dr. Frank. Is there any questions at this particular time?
Sure. I do have one question. Thank you for your thing this evening. The question I have is the fluoride that we are discussing this evening. Is there another alternative for a different form of fluoride that seems to have maybe, I don't know, I'm not a specialist on fluoride, so is another form of fluoride that seems to have less toxic ingredients as they discussed earlier?
First, I have a question. I would question the issue with regards to the toxic ingredients. I would like to see that information. Also, with regards to the provision of fluoride and other circumstances, certainly that would be something that I would leave to Mr. Stewart, the CEO, but certainly that's something that I can look into and provide further information on the alternatives as opposed to the hydrofluorosilicylic acid. But as I've noted is that particular chemical, in fact, does meet the NSF standards that I think the previous speakers questioned.
Thank you, Mayor. Just to go back in terms of, who has cavities and who's not. My daughter, she's 7 years old, had 14 cavities, lives in Tecumseh. So those arguments in terms of genes, that's hereditary. I have 0 cavities, I'm 46. My question in regards to dentists and that, do we have an endocrinologist? Because I think the issue here is the effects it has on the body, the toxicity level. So yes, in terms of cavities, but if it takes care of your cavities and keeps your teeth, helps with tooth decay, but it affects your organs, to me, what's the lesser of two evils? So I'm more interested in getting more information on the toxicity that it has on your body as you're growing up. We don't know, and so in terms of more information, I'm inundated with all this information, and I want to go through this, but that's one area that I'd like more research on and more information.
And certainly I would be pleased to provide that question along with the previous question, the answers to.
Deputy Mayor.